Good morning again, Dr. Walker from denwalker.com. Welcome back to the channel. Today I'm going to talk a little about potassium. I sort of mentioned that in a couple of videos before and the benefits of them. And specifically today I'm going to talk about it relative to helping with blood pressure concerns. So yesterday I talked about magnesium and the benefits of magnesium and blood pressure. But before I get to that, let me also say this. Most people that know me personally know that I am a big proponent of three things, and I think that most people, unless you have your doctor telling you don't do this, I don't know why they would do that, or you have some other reason for not maximizing these three things. My recommendation is always to maximize these three things. So, you know, my kids, my wife, my family, people that work with me, people that work for me, they fully understand what I tell them regarding these three things. Vitamin D, D3, K2, and magnesium. Those three things, I always encourage people to maximize those things because they help with so many disorders, and that's from just overall health, for certain malignancies, for blood pressure, for mentation, for focus, for sleep, all of those things. So vitamin D3, and again, I just want to be clear about that. Vitamin D3 helps with blood pressure, helps with relaxation, help with focus, help with protection from certain diseases or disorders, but it needs to be activated by magnesium. Magnesium helps to activate those vitamin D receptors, and so people are told if you take 20,000 units of vitamin D but have low magnesium, then you're shooting yourself in the foot, essentially, because it doesn't work as well without adequate magnesium. And magnesium, again, involved with more than 300 different enzymatic reactions in the body. So if you're not having adequate magnesium, and again, most people are low on, in fact, all three of these things, right? But vitamin D3 they're low on, magnesium they're low on, and K2. So vitamin D3, absolutely. Vitamin K2, yes, and magnesium. Now remember, K2 I mentioned before. K2 helps to mobilize calcium from the tissues and so forth and get it deposited into where you need to get it deposited into, i.e. into your bone. So those three things, I know it's a long way of saying it, but those three things, I think, unless you have a reason not to be on those three things, you should be. D3 for most of us, and your doctor will tell you sometimes your vitamin D levels are normal. Now, I don't know what that means, right? Because they'll tell you that 30 nanograms per milliliter is normal. So don't do that. When they tell you that it's normal, ask them the number, because for me and for people I know, if your levels aren't above 80 nanograms up to 100 nanograms, I would tell you that you're, again, not doing yourself the best, right? Because there's so many things that tell you the higher vitamin D levels, the lower your overall inflammation, and the lower your risk for certain badness, right? Bad disorders. And I can't, so I don't know when I can actually say some words on these things, because I get blocked a lot, or I get my videos taken down because I can't say this word or that word. So, but bottom line is this: get your levels above 80, preferably above 90 to 100. Some people say more than that, but I would say definitely above 80, preferably above 90, and below 100. So that's number one. And so, but before you do that, get your levels checked, right? Get your vitamin D levels checked. I'll put a link in here on how to get it checked. I have nothing to do with that site, but it seems to be a workable site. They can send you a kit and you can get your levels checked. So before you begin to supplement vitamin D upwards, and again, when you check, when you get it tested to begin with, you'll be surprised of how low your levels are, right? Because unless you're actively replacing vitamin D, you're likely going to be somewhat low. Low meaning for me, definitely below 30 is where you're kind of going to be. So remember, and for each 5,000 units of vitamin D3, each 5,000 units, you need about 100 micrograms of K2. And for most people, Magnesium, the RDA tells you about 400 for men, 300 for women, essentially. But, I do 600, and, there's an article I read yesterday saying many people are upwards of 1,000 milligrams a day. That's a lot, I think, but, figure it out yourself if you can. But I would probably stay, just to be on the safe side, around 400 for men, 300 for women, and do that. But anyway, so those three things, and so D3, K2, and the magnesium. All right, now on to, I'm so sorry, the potassium. Potassium, one of those things I mentioned before. So I mentioned magnesium before yesterday regarding lowering your blood pressure, and I also now want to talk about potassium. Potassium is another one of those things that help with so many things: reduce the risk of stroke, heart disease, blood clotting, arrhythmias. Right? If you're low, and again, most people are low on potassium because you need so much of it. Right? You need like 4,700 milligrams of potassium for you to be normalized. Right? And that's a lot, and you don't get a lot from most food. If you have your breakfast, lunch, and dinner, or even breakfast and dinner at a fast food restaurant, you're not getting anywhere that you need, and not getting anywhere close to the potassium that you need for your daily RDA. A lot of folks will tell you bananas are good, but bananas are, it's not that much. It's like 300 milligrams you get from like a medium-sized banana. Potatoes is another one, again, but not just adequate enough. So, and the supplements you get for potassium, it's like 99 milligrams. It's just not a lot. You got to take so many of those to kind of get you up to where you need to get to. But some foods that I would encourage: green leafy vegetables, kale, broccoli, spinach, those things, avocados, again, some nuts. Add more of those green leafy stuff. Add more of those to your diet, and I would probably say add those to your diet sort of daily, right? Just to be able to get your numbers up. And you can also try adding some of the supplements again, but supplements would not work as well because you need so much of it to get to where you need to get to. But maximize, salmon, seafood as well, high in potassium, but maximize green leafy vegetables, cruciferous vegetables, avocados, nuts, right? So that you're not running the risk of having, blood pressure disorders, stroke, arrhythmias, muscle spasm, muscle aches, and those things. You need so much of it. So just be cognizant of how much you need. And when you're not having those things, if you're not having green leafy stuff daily, then you're running a risk of having all of those things. So the two things I mentioned before, again, now magnesium, the second one is potassium, just to be able to keep your system normalized, your blood pressure somewhat normalized as well. Those things are so important for you. And then, there are other sort of normal daily stresses in life. When you're stressed out about things, or your diet's not right, you're eating a high carb diet, all of those things help to deplete your potassium, which again puts you in dire straits and in trouble and so forth. So just remember those things. So basic things for me, again, your breathing, your drinking water, that sort of stuff. You need to add, unless again your doctor tells you not to, you need to add magnesium, D3, K2. Get your levels checked before you start, though. And now, this one is really about potassium. Adding potassium, adding magnesium, essentially, again, to kind of keep your system normalized, keep your blood pressure normalized and low. Anyway, thanks for listening. Again, have a blessed day. Dr. Walker.